Welcome back to On the Beat, everyone. Isaac hosting again this week, and today we are talking about heart care, and I have with me Dr. Eric McClendon with Baptist Medical Group, Columbus Cardiovascular Care. Good morning, doctor. Happy to have you here with us today.
Thanks for having me. Glad to be here.
Excellent. So we'll get right to it and start off with a very long name procedure. It's called the trans-catheter aortic valve replacement, or TAVR. It's been around roughly 10 years, but what exactly is that?
Well, it's a somewhat new procedure, but it's a procedure where we can go in and replace a heart valve without open heart surgery.
All right, well, that seems like a better option than anything better than open heart surgery. So it says here aortic stenosis, and I guess that's one of the causes or symptoms or something that would prompt you to treat this.
Right, so aortic valve stenosis is a process where the aortic valve is one of the valves that lets blood out of the heart and out to the rest of your body. And as we get older, that valve doesn't open up so well. And it gets stiff or stenosed. Okay. And so that's the disease process. And when it gets really severe, people begin to have symptoms, and that's when the valve needs replacing.
So what would those symptoms potentially look like?
Yeah. So it could vary. So it could be as mild as shortness of breath. Some people can have chest pain or chest discomfort. It could even be as bad as people passing out. Okay. And eventually, if not corrected, people could potentially die.
Now, is there, other than just aging, you said as we get older, it doesn't open as much. Is there any other things that would cause it to do that other than just getting older? So
getting older is the main cause. Okay. There's another second cause. There's something that some people are born with. Okay. And it's called a bicuspid valve. So the aortic valve normally has 3 leaflets or doors, but some people are born with only 2. And the same thing can happen, but just sometimes at an earlier age.
I see. So having less to start with, I guess, would also be a problem. All right, so you do this TAVR procedure without going in through the chest. So what are the benefits with not going in through open heart?
Yep. So, one of the main benefits in general of replacing the valve is people get relief from their symptoms, and we can allow them to live longer. Sure. And the benefits of this particular procedure is with surgery, open heart surgery, you're not only put to sleep, but you have your, chest opened up, you go on bypass, but also you have to stay in the hospital probably about at least 5 days or so. The recovery after, there's considerable amount of pain that goes along with it, and just the recovery time is somewhat longer. Sure. With TAVR procedure, patients come in the morning of the procedure, get their procedure done. They're awake, walking around later that same day. Wow. I tell patients to expect a 2-day stay, but most of our patients have actually been able to go home the following day. Excellent. And they can get back to their lives.
Yeah, absolutely. And then the final question here, how does one find out? You mentioned shortness of breath, but is there any other potential symptoms or tests that you use to help people find out if they need it?
Yeah, so with aortic stenosis, people get something called a heart murmur, and it's just a sound. So what I tell patients and their doctors is if you're concerned about it, talk to your doctor about it. They can get a history, do physical exam, and we have what we call a murmur clinic. And if you have anything that's going on that you're concerned about, it could be nothing, nothing dangerous. We'll see you, check you out, examine you, and kind of determine if and when you need a procedure.
Always kind of to be better safe rather than sorry,
exactly.
Right? Dr. McClendon, we sure appreciate your time today and spending some time with us and answering these great questions. And we'll see you back here soon, I'm sure. And that'll do it here for this edition of On the Beat. Everything for Columbus Cardiovascular Care is available there on your screen. We'll be back after this short break.